Few people realise how much engineering and technology goes into what they regard as the standard hospital mattress. The foam core has to be able to cope with a number of different scenarios. It has to be able to provide support for a heavy patient sitting up in bed, whilst also providing adequate pressure support for elbows and knees of a frail elderly patient. The cover also has to be able to perform, not only to be waterproof, but also to be breathable. It also has to be able to stretch, otherwise it will simply hammock across the foam and not provide any adequate pressure support. The standard hospital mattress is therefore very much a medical device and needs to be treated as such. If it's not looked after, the cover can get damaged, you can get ingress of fluids into the mattress, and this can lead to a risk of infections. As well as that, an increased length of stay in hospital, it also significantly shortens the life expectancy of the product. Both of these significantly increase costs and reduce efficiency. On the 1st of April 2009, the Care Quality Commission issued a list of objectives aimed at raising standards in the NHS. A number of inspection programmes were required, including regular audits, to ensure that equipment was fit and safe for use. Mattresses remain the most widely used support surface in the NHS. It is therefore essential that they are looked after and treated like any other medical device. They need to be regularly audited, cleaned, inspected and maintained. Ideally, they should be inspected between patients, but at least monthly. It is also essential that they are cleaned appropriately following the manufacturer's instructions. This will both reduce the risk of infection to patients and also improve the life of the product. Both of these will reduce costs in the NHS and improve efficiency.
Welcome, and thank you for taking the time to watch this short video on how to audit and care for your foam mattress. We begin by identifying and recording the type of mattress being inspected, noting the batch number, and if available, the installation date. This is usually found on a label near the zip opening. We then check the outside of the mattress for any obvious staining and damage. Most modern mattresses will have some type of welded seam. One of the things you may find when inspecting the mattress is weld failures. If the weld has failed but the polyurethane coating remains intact, it signifies a manufacturing fault and should immediately be reported to the manufacturer, who should replace it. If, however, the polyurethane coating has been torn away from the cover, this generally signifies some form of on-site damage. It is important to note that a lot of healthcare mattresses have sewn covers. If this is the case, check the seams of the mattress are intact. Another factor you need to consider is abrasion damage. Now, we've magnified this cover to demonstrate what can happen when the polyurethane has been removed from the cover. This can be a result of using abrasive cloths to clean the mattress, but most often is caused when transporting the mattress to and from storage. We will look at transportation and storage later on in the video. The next step is to see what's going on inside the mattress. Not finding damage to the outside does not mean there has not been a breach. To aid inspection, the underneath of covers are often light in colour. However, you may come across some that are darker. Under these circumstances, greater care should be taken during inspection. Staining is the easiest method of identifying a breach in the cover. In this instance, the cover should be replaced immediately, as well as any foam that is directly underneath. The causes of staining are often difficult to establish. However, here are a few examples. Sharps damage from needles, vent flons and the like are often a cause for contention and leave circular staining on the inside of the cover. Where there have been repeated episodes of ingress, a ripple effect can be seen. It's worth noting that the breach may not be visible to the naked eye on the top surface of the mattress. Other, more obvious damage occurs in straight lines, sometimes referred to as chattering or skagging. To reduce incidents like these, there are 6 key points for you to remember. Do not place sharp objects such as scissors, needles, syringes and scalpels on the mattress surface. Make sure all jewellery on hands, including rings and sharp edges, are either removed or covered. Take care when using hoists and slings to make sure they do not come into contact with the mattress surface. Particular care should be taken immediately following cleaning, as the mattress surface is more susceptible to damage at this time. Always ensure the bedsheet covers the mattress surface when transferring patients. And finally, make sure transfer boards and pad slides never come into direct contact with the mattress cover surface, as sharp edges and burrs will damage the mattress cover. Another possible cause of breach is through inappropriate cleaning, and this will be dealt with in more detail towards the end of the film. Your next step is to look at the foam. Take a close look at the zip line to make sure fluid has not passed through. Discolouring of the foam by the zip is often seen on mattresses that do not have a protective skirt. If you see any discolouring of the foam, please replace immediately. But be careful not to confuse this with phenolic yellowing, or as it is sometimes referred to, gas fading. This is a result of the polymer reacting with oxides of nitrogen in the air. Please note that the yellowing does not cause any infection or contagion to anyone that comes in contact with it. Next, check the rest of the foam for any discoloration and make sure all is intact with no tears or castellations missing. In line with RCN guidelines for mattress auditing protocols, the FIS test, or Mount Vernon test, is used to determine whether the foam core of the mattress has bottomed out. In essence, what you are testing is whether the bed base can be felt through the foam. In order to undertake the test in the correct manner, adjust the bed so that the top of the mattress is level with the auditor's greater trochanter or just below the hips. With a mattress in situ, stand at the side of the bed, link hands to form a fist and lean forward with body weight only. Make sure your elbows are straight, push the fist into the mattress. Repeat another 6 times at the points shown. If the bed base can be felt through the foam, then the mattress has failed, as the pressure reducing capabilities of the mattress are compromised and the patient is at a higher risk of developing a pressure ulcer. After completing the FIS test, you must now record all your findings. The Invacare audit team use detailed forms to capture all the information and also have a marking procedure in place so they, along with the staff, can easily identify what actions are required for each mattress. For example, if a mattress cover and foam insert needs replacing, they write RC1 onto the side of the mattress. This means replace cover and foam insert. If, in the unfortunate situation that the mattress is to be condemned, then they simply write the letter C. Now let's take a closer look at the cleaning and care of the mattress. There is a perception that the number of mattresses failing audits has and is increasing. However, it is important to note that inspection rates have also increased along with the frequency of cleaning. There is also more focus on MRSA, E. coli and Clostridium difficile, amongst others, and moving and handling is being more closely scrutinised. This, combined with a high bed occupancy rate within the UK, which sometimes in excess of 90%, means the covers on the mattresses will be more vulnerable to damage. So let's look at why they're more vulnerable. Polyurethane coated fabrics are hydrophilic and as such absorb liquids for a short amount of time. This means that the mattress surface temporarily swells and is more vulnerable to damage until completely dry. It is therefore imperative that the mattress surface is dried thoroughly. Prior to use, and extra care should be taken when using patient handling equipment following the cleaning and decontamination process. There is some debate as to whether a 1000 ppm or 10,000 ppm hypochlorite solution is appropriate for use on mattresses, and of course some mattresses offer greater protection than others. At Invacare, we recommend that either solution can be used where appropriate, but you must ensure that the mattress is rinsed and dried thoroughly afterwards. Failure to do so will prematurely age the mattress and eventually lead to breakdown. Protect, Rinse and Dry, the new BHTA booklet, provides detailed information on how to care, clean and inspect healthcare mattresses. The method of cleaning may vary considerably from trust to trust, and the following should be interpreted as guidance only. Before you clean the mattress, you will need the following items: colour-coded container for solution, non-abrasive cloths, domestic gloves, a cleaning trolley, neutral detergents or neutral detergents combined with disinfectants, alcohol disinfectant wipes and warning signs. Always make sure you clean your hands and put on gloves. Make sure the warning signs are displayed and prepare the chemicals in strict accordance with the manufacturer's instructions and training provided. Never mix chemicals and only use the cleaning product provided. Clear all spillages of body fluids such as blood and feces with paper towels and place directly onto a clinical waste bag or dispose of via the sluice room. Take a damp cloth and put it in the solution, remove the excess fluid and wipe over all external surfaces of the mattress until clean. When complete, make sure you rinse with clean water and dry thoroughly using paper towels. Finally, wipe down the mattress surface with an alcohol wipe and allow to dry before reuse. Please note that for a short time after cleaning, the mattress surface is more vulnerable to mechanical damage. You will also need to consider how your mattresses are transported and stored. By following the correct procedures, your mattress will remain fit for purpose. It's good practice to have 2 people carrying the mattress, and if available, always use the handles or a mattress carry bag. When storing a mattress, always make sure it's stored flat. This should be in a location away from the general public. Never store items on top of the mattress, on the floor, or near to radiators and other heating devices. To summarise, regular auditing and adherence to specific care and cleaning protocols can reduce failure, save costs, and most importantly, reduce the risk of hospital-acquired infections. But that's not to say that the onus of responsibility lies solely with you. On the contrary, manufacturers have a duty to explore ways in which they can help, and Invacare are leading the way through educational packages, on-site and off-site training, and perhaps most exciting of all, advances in materials and constructions that are geared to meet the rigorous needs of today's modern practices. If you'd like to know more about what Invacare can offer to support you, please visit this website.